Hi, Dr. Becca here with Del Mar Center for Behavioral Health with another short video about ABA, or Applied Behavior Analysis. We have another video talking about the importance of data, and part of data is that not all data is created the same. And so we have different types of data that we want to take. There's three that we're going to talk about in this video. There is duration, frequency, and latency. So frequency is a commonly used type of data that you're just tracking the occurrence of each of the behaviors. So an example would be, let's say, aggression towards others. So if your child or my child is hitting somebody, I'm going to track the number of times that occurs in an hour or a day, in a week. And that's a frequency occurrence, and so, or a frequency tally. And so it might be as easy as just doing tally marks. And then looking at the trend of that data over time. So we would get what's called a baseline, which is the average or the way or the frequency of that occurrence of behavior without any intervention. And then we're going to apply an intervention. Maybe we'll be teaching them a way to say that they're angry, so functional communication training. And then we would want to see a decrease in that data after we implement that intervention. So again, that's frequency. We're just counting the number of times that a specific behavior occurs. Another type of data collection that's often used in behavior analysis is duration. And duration is not just tracking how often behavior occurs, but how long does the behavior occur. And this can be used for a variety of different things, maybe for a tantrum. So we want the tantrums to occur less often, but we also want them to take less time, so to go for less duration. So maybe we start the timer the first time the child starts to cry, and we don't stop the timer until the child has been calm for 3 seconds or 5 seconds or whatever our operational definition is. Remember, it's important to have a strong operational definition which describes what the behavior looks like, what it sounds like, what it feels like, maybe even what it smells like, to the point that we're all taking the same data in the same way. So again, a duration looks at how long, how much time passes in that behavior. So if during the baseline or the beginning when there's no intervention, we have a tantrum that it's occurring for 15 minutes, let's say. Then we implement an intervention and we want that to decrease the duration of that behavior, right? Because we want the tantrum behavior to last for less amount of time. And so then maybe they're lasting for 10 minutes instead of 15 minutes in duration. So we talked about frequency, which is the number of times that the behavior occurs. We talked about duration, which is how long the behavior lasts. And the last one that we'll talk about today is called latency. Latency is used a lot in schools. It's the amount of time between giving the direction and when the individual initiates a response. So when I tell my child to clean their room, how much time passes before they actually start to clean their room? That would be latency. Or when I say, what is your name? And then I start counting 1, 2, 3. And then they say, my name's Dr. Becca. Okay, so we had a latency of 3 seconds. And so that can be important if we are, well, for a variety of reasons, but it can be a component of a compliance program. It also can be a component of processing speed. So there can be a variety of different reasons that we're tracking that data. But latency is a duration count because we are counting how long between when we give the direction to when the individual initiates a response. So those are 3 of the different data collection methods that we use in behavior analysis. We talked about frequency, which is the number of times the behavior occurs. We talked about duration, which is how long the behavior occurs. And then we also talked about latency, which is the duration of time between giving the direction or the SD, giving the direction and when the individual starts initiating that behavior. Again, data is a hugely important component of behavior analysis. We always want to be making data-based decisions, and we can only do that when we have good data. So it's important to be taking good and accurate data. I'm Dr. Becca with Del Mar Center for Behavioral Health, and thanks for your time.